So let's raise the question, is Maharashtra now really staring at a second wave? That's the question that we want to raise. I'm joined at the moment by Dr. Hemant Thacker, one of Mumbai's leading doctors. Also joining me, Dr. Shashank Joshi, member of the Maharashtra COVID Task Force. When I look at the numbers, Dr. Thacker and Dr. Joshi, Dr. Thacker, for 7 consecutive days of a surge, highest daily addition in 3 months, 2.5% fatality ratio, much higher than the national average. What explains the fact that Maharashtra is once again so susceptible to COVID-19?
At the outset, Rajdeep, I am happy that you are back, but I'm definitely not happy that COVID is back. For the simple reason that in a few days, same time 1 year ago, COVID was looming large on the horizon. We didn't know how it would attack us, and it ruined all of 2020. 1 year later, now COVID is back. It's not looming, but it's within the horizon, but still solvable, manageable. If we are not careful, the bad dreams of last year are coming to haunt us.
Why?
And Maharashtra in specific had developed a lot of COVID fatigue. There was a lot of travel within the city from all over the country, other parts of the world. There was COVID fatigue of the Maharashtra people living there. And because of the business activity, maybe partially also resumption of the local trains, all put together. But COVID inappropriate behavior was the way that we were going in the last fortnight. And because of that, we have paid a heavy price. We are paying a heavy price. To blame the virus and say it's a mutation, to say that the transmission is more. But if you have a mask, if you have a shield, if you have all the norms that you're supposed to follow, you'll keep everyone at bay. The other thing is the vaccination pseudo-confidence. They felt the vaccination is here. We're going to get it sooner than later. We can relax. So all this put together has added to this new situation, which is still manageable, tackleable, solvable, but we have to act quickly. So and I'm happy the CM has taken up the Danda Raj.
Am I to understand? I'm sorry to intervene. Dr. Thacker, am I to understand that you're blaming the citizens? That a mix of COVID fatigue, a pseudo-confidence in the vaccine, as you call it, the fact that Mumbai opened up is responsible for it? Is that what you're suggesting?
Well, certainly, because the indiscipline shown by most of the people, whether it's the upper class, middle class, or even the lower class, mainly the better classes who have started attending gatherings. There is no regulation of the numbers of people in marriages. There is no policing of masks. The youngsters don't give a damn.
But why only Mumbai?
But why only Mumbai? Wear the mask.
Sir, but that's true of the whole countries. But why is it that the numbers are rising in Mumbai? Why not in the other parts of the country then?
I won't say it's Mumbai alone. We are seeing it in 5 to 6 states. And you must remember, Mumbai is the epicenter of the commercial work here. So we have people coming in, we have a lot of activity, we have resumption of economic zones. So, and plus Mumbai is the center where meetings, gatherings, a lot of things happen out of Mumbai. The population density, we are not like Delhi, which we are spread out horizontally. We are built vertically. So we are living cheek by jowl. And if we don't distance ourselves, which we can't, at least we should wear a mask. Our ICUs were empty. Our wards were getting folded up. Our jumbo centers were gradually packed up. Do we have to unroll all that? Do we have to tell our healthcare workers who are happy to be busy vaccinating people that you have to come back because of a fault which was not their own? We certainly have to take the blame on our shoulders because our citizens have not been fair to themselves and their neighbors. So I think strongly the CM's message has to be followed.
Let me come to you, Dr. Joshi, because interestingly, it's not just Mumbai. We are seeing a resurgence of cases in Pune and crucially, even in Vidarbha. When I look at the numbers, it is the districts of Vidarbha where they've gone up by a big amount. Nagpur 33%, Amravati 47%, and there are suggestions that some of these are the new strains of a coronavirus that have led to the surge in parts of Vidarbha in particular. Now, again the question, why only Vidarbha? Why are we not seeing these strains in any other parts of the country?
Welcome back, Rajdeep. It's nice to see you, and thank you for calling me over with Dr. Thacker. Couple of points. Maharashtra has 3 heterogeneous clusters. One is the Mumbai MMR cluster, second is the rest of Maharashtra cluster, and third is Vidarbha. You touched upon Vidarbha first. Before that, I would like to tell you that Kerala started it, Maharashtra followed it, and rest of the country may follow it. After that, exactly 1 year earlier, we had the same trend starting from Kerala, followed by Maharashtra, followed by rest of India. I hope and pray this time we can completely stem it down. Number 2, Vidarbha. Vidarbha had 2 geographies. Vidarbha and Marathwada had 9 pockets which were identified, which were having small heterogeneous clusters. There was lack of total COVID appropriate behavior, no masking, social gatherings, Gram Panchayat elections, and a cold wave. And also Vidarbha is a less exposed region. There is a particular cluster in Amravati where freakishly the test positivity rate one day went to 40 and 50%, probably because of a small denominator. But having said that, there was a potential possibility of a strain there. And that probably the BJ medical microbiologists have identified 4 such cases of 384, which today also the Dr. Vinod Paul has admitted it is possible, but agencies are verifying that strain. But we can't blame just to the strain. Virus is going to mutate. But COVID appropriate behavior is mandatory. Masking is mandatory. In rural India, in Vidarbha, in Marathwada, people had forgotten it.
No, but Dr. Joshi, why is it that rural UP or rural Bihar is not witnessing a resurgence? Why rural Maharashtra? This is what is troubling. Kerala and Maharashtra seem to be the 2 epicenters.
So Rajdeep, you are absolutely right. There is a likelihood of a strain, and we cannot rule it out. But we need science to dictate it, and let the scientific agencies come and confirm what BJ Medical College microbiologists confirm. They have already confirmed there are 4 cases from Amravati with 384, which is similar to a highly transmissible variant. But we need to confirm it. Without confirming, it will be premature. Number 2, rest of Maharashtra is a mixture of both. And as far as Mumbai is concerned, 20 lakh commuters in trains went up to 35 lakhs. Mumbai is as Hemant said, not a horizontal city, vertical city. Total, and Mumbai had a thick tail of 350, 400, doubled up when the testing doubled up. There is one more fact which I want to highlight across Maharashtra, which probably UP may have done and Maharashtra may not have done, is community testing had come down tremendously. Only hospital-based testing was going on. Now they have ramped up the testing, numbers have gone up. But the one good thing is the death rate is very low. The case fatality rate which you mentioned is a compounded death rate.
Okay.
Right now also Mumbai city today at 600 and only 3 deaths. So if you look at deaths don't lie. Numbers may still be erroneous.
Okay, so you're
clearly Mumbai cluster is coming down. Mumbai is a yellow signal. Rest of the Maharashtra is a yellow becoming red. Amravati clearly is red and locked in with micro-containment. Lockdown is not at all a solution. Micro-containment is a solution. Masking is a solution. And COVID appropriate behavior. And you have to take your own responsibility.
Okay.
Means all the campaign of the Chief Minister has to be lauded because he's made an effort and appeal.
So I take your points. Just 30 seconds to you, Dr. Thacker. Is the lockdown very quickly? Is the lockdown, another lockdown inevitable, therefore in Mumbai and Maharashtra, or should you go for a micro-containment strategy?
I think we will be able to avoid a lockdown because people in Mumbai realize it. People coming to Mumbai realize it. And if we go for micro-containment, we'll see that the phones stop ringing as they are ringing now. Okay. And we'll see that the ICUs don't fill up and people should get better. In addition, the vaccination program should gather a lot of steam. So we have to fight at both ends, 2 ends of the coin. If we do that, we will not have a lockdown. And the CM has wisely cautioned people. He really doesn't want to bring down the industry and the city to a halt. And we have to see that his appeal does not fall on deaf ears.
Okay, let's leave it there. 2 top doctors telling us just why Maharashtra is the epicenter once again of the COVID spikes. Let's hope better times sooner rather than later. Appreciate both of you joining us on the show.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.